International Men's Health Week starts on Monday, ends on Father's Day, which is next Sunday, June the 19th. If you forgot, get out and get a present. In the UK, one man in 5 dies before he reaches the age of 65. There are lots of other facts and figures I could give you. You might think that men are better off. When it comes to health, it seems not. Now, Martin Todd is the Chief Executive of the Men's Health Forum and joins me now. Martin, thank you so much for your time. Why do we need an International Men's Health Week? There you are.
Because of the reasons you touched on, because men still aren't healthy enough, because in the UK, 1 man in 5 dies before the age of 65, because men's life expectancy at the moment is declining. So men are 3/4 of premature deaths from heart disease. They're more likely to die from most common cancers. So there are lots of good reasons why it makes sense to direct not just men's attentions to their health during Men's Health Week, but also the health system's attention towards men's health during Men's Health Week.
Now, you talk about, especially, with the higher, the other thing is suicide as well. Suicide figures as well for men are very high, aren't they? Men are more likely to get cancer than women, and more likely to die from it. 67% of men in the UK are overweight or obese. Wow, is it for real?
Yeah, men are more likely to be overweight or obese. They're more likely to have diabetes, and more likely to have undiagnosed diabetes, more likely to have hypertension, more likely for that hypertension to be undiagnosed. Men under the age of 80 are 50% more likely to die from COVID as well, which never got much attention during the pandemic. Men are a much higher risk from COVID and never got talked about. And as you talk, men more likely to die from suicide. So what we're saying to men, and what we've seen during the pandemic, is that a lot of men missed having conversations with their doctor, maybe missed the chance to get cancers diagnosed early, prostate cancer or other cancers, maybe haven't had their heart disease diagnosed early enough. And so what we're asking men to do this Men's Health Week is to have an MOT, check in on their health. If there's something that worries them, see a health professional, but do something about it. It's time for men to give attention to their health. But also this week, we're also asking that the Britain's health policy, that the government needs an MOT. We want to have a men's health strategy. And so we're also calling on the government to do more to get the right services in place and the right support to help improve men's health, alongside the women's health strategy, which we also strongly support.
Yeah. Okay, so here's something, and call me sexist if you like, but in general, especially when it comes to older men, and I don't know, we should ask our callers and listeners if they agree or disagree. Older men in general do not present, we know factually, they don't present with an illness until it's some way down the line. That, you know, it's very difficult to get, especially older men, to actually admit something's wrong. I mean, how do you change that mindset so that men are more involved in, if you like, preventative health? I mean, we talk about breast cancer and checking your breasts, and you've got it in changing rooms. And women are often the gatekeepers of a family's health. It's usually a woman nagging a man to go to the doctors. How do you change that mindset in men?
I think it's a really good point, and I think there is a whole thing to do with how we treat men and their caring responsibilities, both for themselves and others. But there's an interesting stat for you, which is men definitely don't go to the doctor as much as women. Certainly during working age, during their 40s, it's half as much. But the day they retire, the difference in going to the GP vanishes. And interestingly, it's often the cancers that people get later in life sometimes are picked up earlier amongst men. So the picture that we have, which is that men throughout their lives don't go to the doctor, isn't always true. It's certainly true during working age, because men on average work longer hours, they commute longer distances, they're more likely to work away from home. And those are the men that are often not having problems picked up early enough. So a lot of it is actually about working age men. And there is this whole thing of you don't want to show weakness in the workplace. Workplaces aren't that supportive. We make jokes about men who take their health seriously. We talk about man flu. And that's where we're all saying to men, if you're worried about flu, if you're worried about passing on an infectious disease, you're less of a man. That's what we say to people. And then we're surprised that men don't use health services. And let's also not forget, as a woman, you get invited in for cervical screening. You get invited in for breast cancer screening. What do we get? I mean, we both, men and women, have bowel cancer screening, but we get invited in less than women do. And we're also, traditional roles mean we're less likely to be looking after children's health. So we're just less in touch with the health system. We know it less well. Work pressures stop us using it. But as I said, what's interesting is if you look at the stats, when men retire, they go to the doctor just as much as women do.
It sounds like maybe doctors' hours have a part to play here, because if you've got those working hours and your boss is less sympathetic about you taking time off to go to the doctors between, I don't know, 8 and 5, then that shuts you down. I mean, if there were such things as, say, I don't know, evening clinics or something, or men's clinics, do you think that would go some way to addressing all of that?
I think it would help. I think sometimes the NHS isn't good for men or women who work full time. You know, the classic of needing to be on the phone at 8:30 in the morning to get a GP appointment. Well, that doesn't work for women who work full time either. So I think the NHS, there are things that we need to think about with that, particularly in terms of people being able to access appointments. And I think also we need to start young. I mean, I don't think men are told enough about their health. I don't think they know the risks that they're under. I don't think women are actually either. I think there's a whole job that can be done to improve health education and awareness so that, you know, men are just more aware of their health, more used to talking about it, and more aware of how to use the health system to get help when they need it.
Yeah, because when you look at it, I think a lot of young men, or if you say teens and what have you, a lot of them, their first contact with any health services will be through a sports injury or, you know, bruising or hurting themselves, you know, but not in a preventative. They're not preventative health isn't talked about. Now, smoking and sorry, I was going to say, and also smoking and things like diets, and I don't mean losing weight diets, I mean nutrition. That industry tends to be aimed at women, doesn't it, rather than men?
There's a lot of sexism about it, actually. Yes, so by default, about 90% of people at a weight management course will be women. There was an interesting study done in Oxford, but one of the things that's interesting is it appears to be the case that health professionals are less likely to refer men, even when they're overweight. And there was an interesting study done by Public Health England, which showed that human beings, male and female, are better at policing women's weight. We can look at a woman's body and we'll know if she's overweight. We don't do that with men. So here am I. I'm actually borderline overweight, and if I eat too many pies, I'll flip over into a beast. But somebody who looks like me is less likely to be referred unless you actually, you know, make it a norm. There was a study in Oxford where they did a rules-based approach, and they said if somebody has a body mass index of more than this, then refer them. And the number of men going to weight management clinics doubled. And when men go, they do really well. So again, a lot of it's about just sexist assumptions about what men are like, what a big man looks like, whether that's overweight or not. So there's a lot of sexism. So one of the reasons is that we don't tell men that they're overweight. I'm not sure that we want to get into blaming and stuff like that, but I think there's a thing about awareness, letting men know that if they're one of the problems for men, and one of the reasons why being overweight for men is more of a problem, is we put all our weight on around our waist. That's one reason why we're more likely to put pressure on our organs, get diabetes. And so actually waist measurement is one of the MOT checks we're suggesting for this week.
So, Martin, people can go online, look at the Men's Health Forum, and you've got a great health MOT that they can look at. Thank you so much for this. You've really convinced me we actually really do need an International Men's Health Week.